I've worked at Harlem Hospital for just over a year now. I had my 1 year mark at the beginning of April. And I feel incredibly lucky to be there. And I feel like I've learned so much already, even before coronavirus happened. And especially now that it has happened, reinforcing my love for medicine and love for nursing, and being able to be someone who is that stable support system for patients and families alike, especially in the time right now.
What it has been like working at the ICU in Harlem amid the coronavirus outbreak.
It's almost hard to describe. It's such a mix of emotions and things, and every day is different. It's been, of course, one of the hardest things we've ever had to do. At first, it was the anticipation. We knew it was coming. How can we prepare the best we can without fully knowing the scope or exactly what it's going to be like when it hits us? And then there was, the first patient, and then more patients started coming, and then it just, every day was different. It was growing exponentially. Every day there's new issues, and we're learning, even more so, flexibility and being able to be creative.
When we talked earlier, you were talking about just how the illness can move so quickly, and also the
Yeah.
scope of death. Can you kind of
Yeah.
put that experience in perspective for people?
There's such a range of what your symptoms can be. They can be very mild. You can be asymptomatic, which means you have no symptoms, so you don't even know that you have it. But one thing we are also seeing is people are decompensating very, very rapidly. So, they could come into the ED, the emergency department, for shortness of breath, and then with hours or less time, they can decline very, very rapidly, and we'll be forced to throw them on some kind of oxygen supplementation, or even if we have to, intubating patients, which means having a machine help breathe for them because their lungs are unable to themselves. We're seeing people flip like that, which is the scary part about it. In the last month or so of coronavirus, I've probably seen or heard of it. Definitely been involved to some capacity in more deaths than probably in the last year as a nurse in the ICU. We're definitely in this crisis mode. We're working so much that you get up and you do the same thing every day, and you come home and you eat and you sleep, and then you wake up and you do the same thing. And it's like the cycle you're getting on with, and some of us are not giving ourselves enough time, I think, to process. I think it'll definitely take some time after this, be able to step back and process all that we're going through.
Most of us at this point have kind of a moment where we realized the scope of this. Can you talk to me about that moment that you realized the scope of what we're going through?
I think it was the first or second week of having COVID patients on my unit. This particular patient was an older patient, and I had been working with them the last 3 days. And I knew that their prognosis was very poor. And it came down to a decision that was made with the providers and the family, that they no longer wanted to escalate care. And the family decided to do something called terminal extubation, where the patient comfortable, and then actually turn off their ventilator, because they decide that they don't want their family member to suffer anymore. There was nothing more that we were able to do for this family member. They had already, the patient, they were incredibly sick. And again, we had exhausted all of our treatment options for them at that point. And so the decision was made, again, with support of the family, that we would turn off the ventilator, and keep them comfortable to turn off the ventilator. And so, being that it was my patient, for those 3 days, I felt very adamant that I wanted to be in the room for that patient. I think when it really hit me is when I was waiting for one of the doctors to be in the room with me when we did turn off the ventilator. And it hit me that, I was one of the only people that had been in the room with that patient for the last 3 days. And, they were likely going to pass away, and they weren't able to have their family members there. And that was, I think, the hardest thing for me, because I'm thinking about my family members. And so I'm sitting in this patient's room, looking out the window, waiting for the other provider to come in, and just looking at New York City. And that's when it hit me, the scope and the reality really hit me. Actually, I started crying as I'm covered in my PPE. No one can see anything but my eyes, and I'm looking out the window and just have my patient behind me, knowing that their end is coming soon. That's when it really hit me, the severity and the scope of our new reality with coronavirus. So that was my moment of being like, we're in this. This is no longer a potential thing that's going to be hitting us. It's here, it's now, and we're in the thick of it. But I also had this moment of this feeling of gratitude for being able to and for being able to be a part of this fight against coronavirus, and also be able, reaffirming why I love what I get to do as a nurse and being there for my patients. And their family wasn't able to be there because we weren't allowing visitors. So at this point, I'm going to be this person's family. I'm going to be here with them.
How do you think this experience is going to impact the rest of your life, and how are you going to look back on it?
Well, this pandemic is unlike anything that we've really seen before. Obviously, this magnitude, especially with our present day medicine, and so it's opening our eyes to a lot of things. I mean, not just in the healthcare field, but I think in other fields as well. Those that are able to work from home, those that aren't able to work from home, and how when a whole city like New York shuts down, the millions of people that are affected by it instantly, and how that changes everyone's life so greatly.